Every woman is going to experience menopause in some point in her life. And within 5 years of menopause, 84% of women are going to experience painful sex and irritated bladder symptoms. In today's video, we are going to talk about the Genitourinary Syndrome of Menopause and explain why many providers are underinformed or misinformed about this diagnosis, the symptoms that are associated with it, and what are the treatment options. GSM stands for the Genitourinary Syndrome of Menopause. Here are the symptoms of GSM. This includes, obviously, vulvovaginal dryness, irritation, itching in the vulvar structures. It can include urethral pain, pain during intercourse, lack of orgasm, diminished orgasm, urinary urgency, frequency, hesitancy, meaning it takes more than 5 to 10 seconds to start your urinary stream. People may have incontinence during sexual activity, stress incontinence during activities such as things like jumping on a trampoline with your grandchildren or taking a little run. All of these things are tied to hormonal deficiency as well as pelvic floor impairments and are treatable. Many people think menopause consists of hot flashes, insomnia, and irritability, which it of course does. But the GSM component of it begins with the lack of a period, and actually sooner in perimenopause, and will continue to decline throughout someone's lifespan because we do not have appropriate estrogen, testosterone, and pelvic floor motor control, strength, and function. It is normal that this is established when people hit their late 40s, early 50s. But what people do not understand is that the changes in our musculoskeletal system and the changes in our hormonal decline are progressive and degenerative and will continue to occur basically until we die. So hormones are until death do us part, and part of the reason is that they affect our vaginal pH. So when we look at what happens in a premenopausal vagina versus a menopausal vagina, there's a difference in pH levels. When we're talking about the changes in the connective tissue and the architecture integrity of the pelvic floor, if the urethra is coming down into the vagina has a higher pH, people are going to be more willing to get infections. And this is going to happen frequently. And because the sensory neurons are different than they are in a premenopausal vagina and urethra, women may not feel as symptomatic right away as they did when they remember having a UTI in their 30s. As a result of that, this can fester and lead into a bladder cystitis, which is an inflammatory, non-infectious condition of the bladder that can have consequences higher up in the urologic tract. The same thing can go on in the vagina, and that people are experiencing bacterial vaginosis, vaginitis, yeast infections that they may not feel but are compromising everything that's going on with their pelvic floor muscles and the vaginal mucosa. Without treatment, these things will continue to progress. With treatment, this whole process of a downward spiral can be effectively stopped. GSM, Genitourinary Syndrome of Menopause, is a progressive degenerative situation that will continue to progress in terms of a functional deterioration unless there's treatment. This is important for me as a pelvic floor physical therapist because we also deal with overlapping symptoms of urinary and gynecologic pain and a lack of normal function. The combination of appropriate local hormone therapy with pelvic floor PT can help women reduce the bothersome symptoms that they're dealing with. The majority of medical providers are not aware of how to treat GSM. This is a fact. It's published multiple times in various medical journals that include gynecology, urology, pain management, and neurology. And the reason this is the case is because if leading societies just coined the term in 2014 unless people are seeking out physicians that are handling a woman's reproductive care from teenage years through menopause, are actively seeking out advanced medical knowledge and how to manage GSM, they may not even be aware of some of the treatments that exist. There's an increasing pressure on doctors in today's community to see more patients, less reimbursement, and they aren't able to develop specialized skills for things such as menopause without the funding. So the reason this is so difficult for many women is a lot of times women have trusted relationships with their gynecologist. The person who delivered someone's babies, though, may not be the right person to handle their menopause transition. And that is because that person is wearing many hats. And as of most recently, management of menopause has become a specialty within itself. The reason I care about this is because it does affect people's pelvic floor function and their comfort with their urinary health and their sexual satisfaction. We can help people restore orgasm, reduce urinary urgency frequency, reduce urinary incontinence, reduce painful sex. But it affects both the pelvic floor and hormonal management. And what we can see in our clinical practice is that many of the women are not provided accurate information. They are seeing their providers for a yearly pap smear. They may not have time in that brief appointment to talk about menopause. We do in physical therapy. And so we're having the conversations with our patients about how they think about their hormonal health, how they think about their genitourinary health. And if their provider can't provide what they need from a medical perspective, we can refer them to somebody who can. So treatment of the GSM symptoms involves local and topical hormonal therapy that can help the pelvic floor muscles, areas of the urethra, the bladder, and the vestibule restore normal connective tissue integrity. Pelvic floor physical therapy will help restore normal neuromuscular control, which can help with bowel and bladder function easiest, and then sexual function second, helping people restore orgasm and reducing pelvic floor pain that people can experience during and after intercourse. If you are in menopause, every woman should undergo a pelvic floor physical therapy examination to optimize their pelvic floor muscle function, because in addition to the urinary bowel and sexual component, it's part of our core muscles. And it is not uncommon that people have hip and low back pain, and studies show that 97% of people with hip and low back pain also have pelvic floor dysfunction as we enter into our 4th and 5th decade of life. The combination of pelvic floor physical therapy and appropriate hormonal management can help our patients get to 100% and live the way that they want to live for the next 30 years of their life past menopause. If you are experiencing symptoms of GSM, please give us a call at one of our clinics, or we are available via digital health consult.